Since 2014, our country has been plagued by divisive forces. TMC is in Meghalaya with the mission to empower the people, uphold the ethnic cultures and traditions, celebrate the sacred land. To oust the proxy BJP government from Meghalaya, be the change, support TMC by calling on 96877 96877.
Today I want to inform everyone that a form of specialized treatment called a plasma exchange has been started here in Woodland Hospital. Plasma exchange is a form of a blood purification system. It's different from the dialysis. It's a process where we change the plasma of a patient through a special filter. We connect the filter to the machine. It could be a dialysis machine. And it's a very simple procedure where it takes only around 20 minutes for the procedure to happen. All the plasma of the patient, we exchange it with the fresh plasma. That is the plasma which are deficient of the factors which are harmful to the patient. Patients who require plasma exchange are usually those patients who have antibodies in their system, like special cases of TTP, which is thrombocytopenic purpura, any anti-GBM disease, or cases of SLE also who don't respond to treatment. So cases of TTP especially, this is a first line indication of starting a plasma exchange. So this I want to inform that a special case has come to me. This is the first case that I've seen in my practice independently also. A 39-year-old female had come in the month of June this year to our hospital. Initially she was shown to a medical specialist, Dr. Ritwik Burman. So he had seen the case and he had found that the blood profile of this patient was deranged. Her hemoglobin was less, her liver enzymes were deranged, as well as she had some impairment of the kidney function. So in that case, he referred the case to me, and her creatinine that time was 2.5, and her platelet count, that is platelets are a component of the blood. Her platelet count that time was only 4,500. The normal platelets in the body is around 1.5 to 4.5 lakhs. So the immense danger of this patient, where she had only around 4,500 platelet count, where she has a chance of bleeding. So this case, we had suspected it to be a case of TTP. And initially we couldn't start the treatment as such because we need a confirmatory test. So this test we had to send to Delhi, and it took another 3-4 days for the lab reports to come. So in the meantime, while waiting for the test reports, we have started her in platelet transfusions. So even though she needed around 18 units of platelets during her hospital stay, we started her on steroid also. However, she didn't respond to the treatment as such. So when finally the lab reports from Delhi came, her ADAM-TS13, which is a confirmatory test for acquired TTP, was only less than 0.5%, when the normal levels were more than 10%. So here immediately we started her on plasma exchange. Plasma exchange is very simple. It's only a 20-minute procedure. So on the first exchange, her platelet counts were around 20-30,000. The second exchange also it didn't rise. However, on the third exchange, her platelets rose to 60,000. And by the fourth exchange, she didn't require a platelet transfusion anymore, and it rose to 72,000. Here we understood that yes, the patient is safe from danger, and we decided that we could release the patient and discharge her. We discharged her on medication, some injectable medication which are called immunosuppressions, and we follow up the patient. So again, she was discharged in June, and she came back again 2 weeks back, and she's completely stable. Her platelet count is around 1.7 lakhs. There's no fresh complaints as of now. So acquired TTP is a very dangerous disease. Without treatment, up to 90% of the patients could succumb to death due to bleeding or other complications. Is it a form of dialysis? The plasma exchange is different. It is not a type of dialysis. It's a different form of blood purification. So dialysis, as we all know, the patients have to come to hospital regularly, and we do the dialysis when the kidney function is less than 10%. So patients often come 3 to 4 times a week, and they need an access for the dialysis. However, plasma exchange is nothing like that. We have to treat them only in the acute period and monitor the patients when they might require again.